Good afternoon, Cabot.
Good
Do we have
afternoon.
any guests, visitors here? We welcome you. And of course, we are so fortunate to have before us such distinguished guests. Let me just start by saying that today we set a precedent in every respect. We set a precedent made so more by our distinguished guests and a highly important topic. A few weeks ago, I was listening to National Public Radio, and I heard the guest reference a book by author Harriet Washington. This book, entitled Medical Apartheid, a dark history of medical experimentation on Black Americans from colonial times to the present. The guest on that program was Representative Bud L. Williams, who is with us today, along with former state representative Jeffrey Sanchez, senior advisor, Rasky Partners. Did I get it right? You got it right. And so in a real way, Ms. Washington's work is at the center of this conversation. We're convening today on healthcare disparities in Black and brown communities. This is why. She presents an unflinching, meticulously researched expose of African Americans' mistreatment by the medical establishment. And in so doing, she makes plain the roots of the African American healthcare deficit. The author reveals the insidious medical examinations or medical experiments, for example, on Black women by an esteemed physician who has statuaries in Central Park, at South Carolina State House, its medical school, and the Alabama Capitol grounds, honoring his skill, benevolence, and humanity. However, Ms. Washington presents a shocking account of his purchasing of Black slave women on whose genitalia he performed serious surgery without anesthesia, leaving their bodies, as the writer tells us, bloody battlegrounds. He then used the many years of experimentation to cure white women. Notable, Ms. Washington quotes Martin Luther King Jr., who wrote in 1965 that, and I quote him, "Of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane." The author then shares some troubling numbers about the healthcare divide between Black and white Americans. For example, the life expectancy of Black men is 6 years less than whites. She notes an even closer look at the troubling numbers reveals that Blacks are dying, not of exotic, incurable, poorly understood illnesses, nor of genetic diseases that target only them, but rather from common ailments that are more often prevented and mistreated among whites than among Blacks. We're also told that 3 times as many African Americans were diagnosed with diabetes in 1993 than in 1963, a rate that is nearly twice that of whites. Relatedly, as with most chronic diseases, she writes, African Americans suffer more complications, including limb loss, blindness, kidney disease, and terminal heart disease. Also cancer the nation's greatest second killer, is diagnosed later in blacks and carries off proportionately more often, more African Americans than whites. Further, African Americans suffer the nation's highest rate of cancer and cancer deaths. But the author reveals more equally shocking information also. 86% of white women with breast cancer are alive 5 years later. Only 71% of black women live that long. Notable, black men have the highest rate of developing and of dying of prostate cancer. And despite its image as a disease that affects middle-aged white men, heart disease claims 50% more African American men, and they die at a higher rate than white men. But let me stop here and introduce our speakers. It's always wise to, as I've been told by a sage, to be seen, stand up to be seen, speak to be heard, and sit down to be appreciated. So let me introduce our speakers. Bud L. Williams is a lifelong resident of Springfield, Massachusetts. Representative Bud L. Williams is serving his third term as state representative of the 11th Hampden District, which includes parts of Springfield. In the House of Representatives, he is the House Chair of the Joint Committee on Racial Equity, Civil Rights, and Inclusion, the Chair of the Massachusetts Black and Latino Legislative Caucus, an appointed member of the House Committee on Ways and Means, the Joint Committee on Economic Development and Emerging Technologies, and the Joint Committee on Ways and Means. Williams also serves as a member of the legislatively created Hate Crime Task Force and was appointed to the Governor's Advisory Council on Black Empowerment in February 2023. Prior to his election in 2017, Williams served as Springfield City Councilor from 1993 to 2008, and again from 2011 to 2017. Williams graduated from Springfield Technical College and Westfield State with the BS in Education. He earned a Master of Education from the University of Massachusetts Amherst. Williams is revered for his unwavering dedication. He's an advocate for the well-being of all citizens, working tirelessly on behalf of the entire Springfield community to address issues that may negatively impact the most disenfranchised members of society. Williams is a champion for justice and a healthy community. He is commended for his devotion to civic duties, his unflinching advocacy for the people he represents, and his unrelenting activism for social justice for all people. State Representative Bud Williams is married to Dr. Gloria B. Williams. He is the father of 2 children, Keisha S. Williams and the late Kamari B. Williams, and 3 young grandchildren. A full life, a committed man. Let's welcome him. Now, Jeffrey. Our other speaker is former House and Means Committee Chair Jeffrey Sanchez. Serves as a senior advisor at Rasky Partners, where he works with the public affairs team to provide strategic consulting on healthcare, finance, and other public policy issues to a wide range of clients. Jeffrey is also the principal of Sanchez Strategies, where he works with nonprofit clients on strategic planning and communications, legislative affairs, and community engagement initiatives to impact social, local, state, and federal agencies. Sanchez formerly represented Mission Hill, Jamaica Plain, and Brookline in the Massachusetts House of Representatives for 16 years, where he has been lauded as a leader in healthcare reform, housing and infrastructure, gun laws, violence prevention, criminal justice reform, the environment and youth empowerment. He finished with his last term serving as the chairman of the House Committee on Ways and Means. Previously, Jeffrey served as chairman of the Joint Committee on Healthcare Financing and the chairman of the Joint Committee on Public Health, as well as the vice chair of the Joint Committee on Economic Development. Jeffrey attended Roxbury Community College and received his Bachelor of Arts in Legal Education from the University of Massachusetts, Boston, before serving his Master of Public Administration from the John F. Kennedy School of Government at Harvard University. He is also currently an instructor in the Department of Health Policy and Management at the Harvard T.H. Chan School of Public Health. There we have them. Here they are. They're going to speak to you today.
Welcome, gentlemen. Take it home, buddy.
Thank you, sir.
You're welcome, sir.
Just the way I wrote it.
I've been
First of all, thank you, and for inviting myself and Chair Sanchez to this beautiful facility. A hidden gem, really is. And we, as we're going to get into the healthcare piece, but independent living and assisted living is part of this whole conversation that we're having in Massachusetts, in America now. How do we make things better for a lot of people? First of all, it is Memorial Day weekend. If we have any vets, men or women, I want to thank you for your service and what you've done and what you have meant to this country. That has allowed independent people like me to be giving the opportunity to increase myself. So any military people, thank you. Let me be real brief and real quick, because you are the generation upon your shoulders we stand. And I just want to thank this generation for what you have done for this Commonwealth and for the country, really. That's to be applauded. And you're still probably doing things with your grandkids and maybe your great-great-grandkids by now. But whatever, thank you for what you have meant to many, many citizens. When we talk about health care, and this has become my Bible, and I know that I have my ARP card. I'm a senior, so I know we like to read, and I still like to read. So I'm going to suggest, before I talk about this, it's called Medical Apartheid by Harriet Washington. It's a very powerful narrative, and sets the stage for how black people were treated in the healthcare industry. We all know the story. In 1800s, black people are brought here in bondage, didn't come on their own, came as basically, we say, enslaved. And that aspect brought a lot of, there's scabs and there's scars. A scab is something you heal and then you might rub it and the scab will come off. When you have a scar is there. and it stays there, and it's easily recognized. So as African American man and black and brown people, there are many scars that we've had. And as Dr. King talked about the healthcare industry and the treatment of black people, I never realized and understood the depth of what the treatment was until I started reading this. Someone suggested I read it, and I like to read. And I started reading, and you started reading. And it talks about, sins of America. Slavery was the first sin of America. It just was. We have to admit to that. It was. It wasn't your fault. It was just a system. And as you see the treatment of African American women, when they would take these slaves and they basically became guinea pigs. Basically a guinea pig. Remember how we used to have, I'm dating myself. I used to take biology. And we did biology back in college. You had the fetal pig. Remember the fetal pig? You did the pig, you examined the pig, you did all the organs, you went through all of that. So that's what it was in terms of these doctors experimenting on women who were in slavery and cutting off limbs of individuals without any local anesthesiology, nothing. Pulling people's teeth, experimenting. They became guinea pigs. This happened way back in the 1800s. 1800s. So what happened, it became so bad, and it was the scar that still is with people in the black community. Sometimes we talk about custom and what you hear about and what people tell you is the truth. It's the culture. So that stuck with black people from generation to generation to generation to generation to generation. So just think about it. Just think about it. Just use your imagination for a minute. And if someone said, I'm going to take one of your limbs off, and I'm just going to give you a rag and you're just going to chew it. Just think about it. This happened over and over and over and over again. Toes, amputations, limbs, experimenting. Doctors who were there, who take the charge to protect the community and to make people better and to give them a better place. It never happened. And one of the main cases that is like custom, they talk about the Tuskegee study. And many of you have heard the Tuskegee study. That was the one that really registered and it magnified. And it created this synergy that many of you have read about it, you've heard about it, you've talked about it. That case is still the case that when we talk about healthcare in this country, that's the case we point at. That's the case when they took some black men, doctors, and said that we're going to make you better. We have some medication that we want to try on you. It's going to make you better. It's going to make you healthier. Hopefully it will reverse whatever you have. And they took these needles and they shot black men up with syphilis. Shot them with syphilis. Now this was supposed to be a study, a medical study. So you might know what happened. It became worse and worse and worse. It got bad. People died. So what happened because of that, there's a whole lot of other cases I could cite, but that's the case that's the most familiar case that most people talk about. So with that being said, that created a mistrust for black people for the medical system. It created the mistrust, and you understand, you had the evidence that if I go to a white doctor, I'm afraid he's going to shoot me up with something that's not good for me. Might not be true. You might think about it, but deep, deep down inside, you have this resentment and this understanding that this has been done before. So we're still dealing with that, and that's back in the 1900s. We're still dealing with that mistrust of black and brown people now who will not trust the system. And if you don't trust the system, it's hard. So even during COVID-19, there's a lot of black and brown people that didn't want to take the vaccination. Now, whatever your feelings are on it, whether you want to take the vaccine, you didn't want to take it, from my perspective, that's an individual choice. If you don't want to, that's on you. Me, I took 5 shots, and if they have another shot, I'm going to take the next one that comes out too. I have no problem. So we had a hard time, Chairman Sanchez, convincing black and brown people to take the shot. Because we're saying, we don't know. Are they giving us the same shot? Is it a different shot? Now this goes all the way back to the Tuskegee study when they shot individuals up with syphilis and killed a lot of individuals and disarranged them and made them all confused and everything. So we got through it when we suggested, let's let individuals like myself and Jeff Sanchez and President Obama talk about it's okay to take the shot. I took the shot. I'm a trusted voice, I believe. So that's what we're dealing with. So you could do yourself a favor. I think you can go online, Medical Apartheid, easy reading, really easy reading, by Harriet Washington. It's a required reading for individuals I come in contact with. It will open your mind to understand what happened. So we're still dealing with it. We've come a long way now. We still have a long way to go. But it's folks like you who can make the difference, who can talk to. I know you got a lot of social networks of folks who do a lot of talking, and we have a way at our age to make some things happen in a different kind of way. So I'm going to stop right there. I'm going to let Chairman Sanchez come up. But I want to underline that. That is a real problem in the black and brown communities. It's the treatment. And it's said that black people will go to a doctor, white people go to the doctor, they live. Black people go to the doctor, they die. There's something wrong with that picture. There's something wrong with that picture. This system should be fair for each and every individual. So we're on Beacon Hill and working with the governor and all the leaders to make things better for each and every citizen. So, my friend, I want to thank you for this young man here, all the energy in the world to be able to give us an opportunity to talk to good, well-meaning people. We like it. And I don't know what the requirements are to get in here. I might apply. I'm looking. I don't think I'm. He says I'm too old. He says I'm too old to get in here. I'm too old to get in here. So, thank you. Really, happy Memorial Day. Thank you, and again, thank you for what you folks have meant to this country in terms of your sacrifice. I know many of you were before the Depression or after the Depression, and I always applaud you individuals. So thank you. Hi, Jeff.
Good afternoon. Thank you, Mr. Chairman. Thank you so much for having me here today to also join my great friend, Representative Williams, Chairman Williams. and this great staff here that we have here today. They keep the pieces together for him in the State House and in the community. Because being a legislator, I mean, he's from Springfield. You know, he took the 2.5-hour drive to come here to talk to us today. Yeah, I mean, he's one of the most genuine people that I've met in my career as a legislator. His heart's in the right place, and he challenges himself, right? I mean, think about it. What keeps you alive? You're challenging yourself, and he does it every single day. And he was my partner when I was a legislator myself, and so I'm honored that I get to continue to work with him in my new capacities in my new life as outside of government. And he's my partner in a piece of legislation that we filed together to address the inequities that exist within the healthcare system. And I think that the way that Bud looks at things, you know, my mother used to tell me when I was a kid, you know, don't complicate everything. You know, think simple, stupid. You know, don't complicate it. Ultimately, you can see what's in front of you and get at it. And so I utilize that with Bud in where we've targeted particular areas where we've talked to industry people, we've talked to patients, we've talked to community groups, we've talked to affected folks within the healthcare system, and put together a piece of legislation. And we did it during the pandemic because there were a couple of things that happened during the pandemic. Number one, the murder of George Floyd. The murder of George Floyd, we all knew that there's discrimination, that there is racism throughout this country. And the murder of George Floyd really battered the nation in terms of showing that inequity, even though all of us have seen it for many, many, many years. And all of you probably closer than some of us, particularly during particular eras throughout the nation's history. And not only that, we also saw that when it came to pandemic response, that there were hot spots that we knew were going to happen in terms of people that were infected with the virus. And we saw it in particular communities like Springfield. We saw it in Chelsea, Massachusetts. We saw it in Lawrence, Massachusetts. We saw it down in New Bedford and Taunton. And it was incredible to see. You had populations that had such an incredible disparity where, let's say, in a community that had, let's say, 100 people, the 30 people that were of color, of those 30, 25 weren't ever tested for COVID. And in that, we saw an incredible amount of people that were being infected, but they were also dying. And you would be surprised at how young some of these people were. In the community of Chelsea, Massachusetts, we saw a significant number of people that were being infected for a number of reasons. Chelsea it's an immigrant community. I mean, who knows Chelsea? Who grew up here in Massachusetts? Chelsea has always been an immigrant community. And then in those communities, those rooming houses are still there. It's probably one of the few communities that still have significant rooming houses. And at the same time, a lot of those triple-decker houses, you'd be surprised to see the conditions that people live in. And it's similar to what, frankly, your families and when your families arrived here, or if you were a poor or a middle class family, the conditions that your family members may have lived in at one point in time as well. You know, we went to visit when we were putting initiatives together. We were running into households where, let's say there was a 3 or a 4 bedroom apartment, and in each room was a household. Think of it. If you're in a triple decker, right? In a 4 bedroom apartment, right? Remember the long hallways, and then you had the 3 off to the side, and then the kitchen in the back, right? So imagine a family in each, and in that room there could be anywhere from 3 to 4 people. Okay? And what made it even more poignant to me was when you'd go into the kitchen, because when you went into the kitchen, you saw how many families were there. Guess how? By the number of refrigerators in the kitchen. You would see four refrigerators in the kitchen. And then you would see on the hallway, in the long hallways, sleeping bags on the side, on sleeping bags. You're like, what's that? Oh, there's 4 people that sleep on there, and they pay a nightly rate. It's real. So even though we all live in these incredible conditions, and beautiful areas, and the city's changed, and it's so clean, and you know, the abandonment of Boston. Remember, you know, Boston back in the 60s, 70s, and early 80s? Very different place. If you were from here, from the area. Who's here from, are many of you from Boston? Yeah? So the Boston of the past is a little different than now, right? Right? It's a little cleaner, right? It's a little different. There's a lot more industry, a lot more people, right? So in that, there is also, you know, it's interesting to see that even with all of the progress that we've made, at the same time we see these disparities. So throughout the past year, I've been working with Chairman Williams, and we've engaged, we created an organization called the Health Equity Compact, and in that compact, we have about 70 members that are essentially either chief executive officers or vice presidents of healthcare organizations, community-based organization, business groups throughout the Commonwealth. So, you know, the president of Children's Hospital is a member, the president of the Brigham and Women's Health, the Brigham and Women's Hospital is with us, the president of a community health center out in Springfield is one of our members. So it runs the gamut from big to small. And the idea is to try and figure out how do we get at and target particular places within the healthcare industry to deal with finding equity within the healthcare system. And it's focused on what the workforce looks like. It's focusing on what type of care and how that care is received. It's about how do we educate folks about why is there so many stigmas with communities on receiving health care. So, as Representative Williams mentioned a moment ago, the Tuskegee experiments, all the horrific things that happened in particular to black men and black women, but not just only them. You know, in the 50s there were experiments. You know, when my mother was a teenager in the early 50s, there were the sterilization experiments. You know, those little birth control pills happened as a result of experiments, and Puerto Rican women were the guinea pigs for those birth control pills. If it wasn't for Puerto Rican women that were utilized as guinea pigs, those birth control pills, those experiments would not have yielded that product. So, and this is difficult to talk about because we live in such an incredible country. We have such an incredible history, but at the same time, there are these scars. And what we want to try and do is try to heal those scars, those internal scars within a community, and even right now, because even now, there's still deficits that we have to address. Right now, there's been a health affairs study that's been out for a long time that talks about how black men are treated in an emergency room setting, and it's pretty scary, you know. 2 out of 10 black men don't actually get to sit down with their doctor because their doctor will stand at the foyer, or I'm sorry, at the doorway, and not sit down with them in a treatment room. So some of these statistics that have been out there for a long time, they're pretty jarring. So what we want to try and do is try and talk about these so that we can try and address them, and to do it in a very friendly and to do it in a very inclusive way. And so we're holding forums across the state. Not only are we meeting with you today, we're meeting with industry leaders across the state and with community organizations so that we can build some fire to try and pass this piece of legislation that we've been working on. And in that, we hope to be able to utilize and make better what is already the best. Because here in Massachusetts, think about it. We are in terms of healthcare, there is no better place on the planet to be on than Boston, Massachusetts. I know the people from Pennsylvania think they're special, and the people from New York, they think they're special too. But we here in Massachusetts, there's cold rock up here. There is something up here that for some reason we have incredible brain power. And I think we see it in this room and with the people that we have. And not me, I'm not the brightest bulb around, but one thing I do know is that I had to flap my lips a little bit. You know what I mean? So this is what we're trying to do. What we're trying to do here, and we want to make sure that everybody knows. You know why? And for me, it's an honor to be in front of all of you because my mother's 88 years old. She still gives me a hard time. Every single day she'll call me. What are you doing? Where's the why has my granddaughter called me? My granddaughters have called. She's got her litany of questions to me, and then she says, "Are you okay?" And she's constantly checking in and constantly checking in. And she's telling more stories that I never heard before. Because for some reason, you folks kept a lot locked in there, and now at this point in time, you want to, tell us everything, and sometimes it's a little much to take. But we take it in, and we feel so grateful for all of you, because not only did you all bring us into this world, but we are who we are because of you. And not only physically, but also spiritually and mentally, and as members of a community. So as a member of this community that we are here today, I want to thank you for giving us this opportunity to speak to you. And we wish you all the best, and thank you for all you're doing with you and your families and your broader community right now. So, and thanks to the leadership here for bringing us here to be able to talk about what we're working on.
Thank you, Chairman. Just something we did during COVID. How many of you use telehealth? Telehealth.
Telehealth.
Talk to your doctor on the phone,
or
on
your
video,
computer.
on your computer, on your phone. Will you raise your hand if you do?
Yeah.
That's a new thing that we did during COVID. You want to speak to that just a little bit, Mr.
Yeah.
Chairman?
So a couple of years ago. So my last charge in the State House, I got to write the state budget with Charlie Baker, right? So how are you going to spend the money? And Massachusetts is really unique, because what we have done relative to our Medicaid program exists nowhere. The Medicaid program is essentially the program that serves frail, elderly, poor. And that program, under a law, was built, the law that passed Obamacare was passed as utilizing the framework that we did here in Massachusetts. Massachusetts is the only state in the nation that has 98% of the population insured. 98% of the population insured. And we did that under something called shared responsibility. Shared responsibility meaning that you and me, we have responsibility over ourselves and engaging the healthcare system. The healthcare system has responsibility, the business community has responsibility, and government has responsibility. And in that, yes, there was a lot of turmoil when Donald Trump came into office because he wanted to abolish the whole thing. But the framework of what we did here in Massachusetts is what is known as Obamacare. Remember Ted Kennedy? So Ted Kennedy, remember Orrin Hatch? Remember Grassley? Remember Ted Kennedy at the time. I mean, he maneuvered all these different people to talk about the possibilities. So much so that the biggest equity program that the country has right now is the expansion of Medicaid. Because as we all know, with your health, you have nothing. And that focus has brought in a greater dialogue about how we're going to do better. Have you noticed that you're here in assisted living, but people aren't pushing to try and get anybody into a nursing home anymore. And if you see what's happening now, the nursing homes are collapsing because the home care industry is exploding. Assisted living and rest homes are steadily expanding because the change that has happened as a result of more people receiving care and receiving more attention than what they have had in the past. When all of you were growing up, it was a bit different. It might have been, the Catholic Church here in Massachusetts had a big presence. The old Presbyterians and the Lutherans and the religious communities had a lot to do with the social safety net. Now it's all in government's hands, the majority of it. And so all of this expansion that has happened has brought a different change. And so with what we're doing here, we're trying to modernize how the system should be talking to you. And some of it is a bit, some of it's a little uncomfortable. You're not used to speaking to a screen. At the same time, I've noticed that some of you take onto it really, really well. And and you'll see that more people have taken onto it better than most. But we've had to change the finance system to be able to get to that. And that's what Bud was able to finish what I started when I was in the legislature in 2019 and 2020. So that one thing, when people say you can make a difference, Bud had a piece in that. He had advocacy in that because in his community of Springfield is in a primary care shortage area, meaning that they don't have a high number of concentration of doctors to treat people. So they have to figure out how do they get people in front of, in whatever way they can to get in front of practitioners. And that one thing is making a difference in his community, and getting the word out and making sure that people are staying at home and healthy as much as they can, and keeping them out of an institutional setting, where institutional settings, we all know, are very expensive, as well as the emergency room in the hospital. So again, all this conversation is all this conversation is to try and make sure that we're doing as much as we can to improve the condition and the quality of life for everybody here in the Commonwealth. So thank you again for this opportunity.
Thank you.
Thank you.
Are there questions? Feel free to raise questions. Attorney Buchholz.
Yes, hi. Thank you so much for speaking with us today. So, question comes to mind to me about what's your best approach to dealing with, number one, the insurance industry, and number two, big pharma, who want to get their hands on every piece of money that they can, and we wind up paying them rather than getting the care that would best serve us. I mean, telehealth is great, but you know, to have a hands-on meeting with a physician, there's really no substitute for that.
Right.
So, I mean, what are your best strategies to deal with these problems?
So again, here in Massachusetts, you're in a unique place in that Massachusetts has pushed pharma to the point that in Massachusetts, we're one of the few states that negotiates prices on drugs within the Medicaid program, and by doing that, it pushes everywhere else. It sets the standard for the commercial market as well. Now, you know that the insurance companies they're the middleman, right? And the middleman, they take a chunk out of this. And they're negotiating, and every contract that they negotiate is in secret, because they're in a competitive environment, because we are a market-driven, the healthcare industry is a market-driven system. So us going at them all the time has pushed them to do things that they normally wouldn't do. Like the Blue Cross Blue Shield the other day, a couple of months ago, announced that they're going to look at how they're going to factor in equity in their contracts that they're writing right now. Now, I wanted to push them towards that back in 2004, 2005, when we were working on the universal coverage bill, but you know, you could only graze so many cows at the same time, you know, and trying to get, and those of us that were progressive lawmakers, we were going up against big business. And in terms of pharma, we had been pushing on pricing in particular areas. When we saw that Sovaldi, you know what Sovaldi is? Sovaldi is that drug that they use for hepatitis C that's the cure for hepatitis C. And when Sovaldi came into the market, when Sovaldi came into market in 2008 or something to that effect, you'll have to, my dates are off in my head a bit. But when it came into the market, it was a blockbuster for state budgets. For our Medicaid budget, at one time, we were spending, I don't know, maybe $1.5 billion on pharma in Medicaid alone, in a $10 billion program at the time. So imagine a tenth of it was being spent on pharma. But you could see it because there were more people, you know, they're trying to keep people out of hospitals, and the majority of the money spent on chronic care. So when it came to Hep C, this disease came, you know, hepatitis C, it's a blood-borne disease, right? So, I mean, there's all kinds of horrible things that happen to you if you have hepatitis C. So when it came into the market, the ticket price of it was something like $1 million a year, right? It was expensive, right? So imagine you had at the end of that fiscal year, we're looking at what we spent the prior year. It was like $400 million on everything. And then in that 1 year, we saw that it shot up to $800 million. And that one drug shot it up. And that was a big punch in the face to government, and also to pharma, because pharma's like, uh-oh, we got something here. And because government started paying attention. And as a result, 15 years later, look what President Biden just did a few months ago relative to the pricing of insulin.
Insulin.
Where he has banged and banged and banged and banged, and even Congress. I think this is where, you know, with this, you know, unfortunate, I don't know, this unfortunate wall that exists between parties. You know, that I think that this is something that people agree on, that we've got to get rein in costs
Chronic,
relative to these chronic care drugs that are out there right now. Think about all the things. Metmorphin. I mean, how many people in this room are on metmorphin? How many people in this room are taking that Eliquis and the other one and the other? And each one of those are ridiculously expensive. So there are certain ways that I feel like they're trying to shame them. The government is trying to shame them to bring them to light. But I think that if it doesn't change dramatically, I think with time it's good that Congress and the president would do something, because it's affecting everybody.
And good point, because I represent a very poor district on one hand and a very affluent district on the other hand. And many times folks come to my office and they talk about insurance companies. It's not the doctors that are driving your care, it's the insurance companies. They will say, no, you can't have that, you can't have this, you can't have that, you can't have that. Now back 20, 30 years ago, that wasn't the case. The doctor would say to you, sir, I'm going to put you on medication A, B, and C. Now, before they can do that, they have to get it cleared with who? The insurance companies. That's not right. And why should America, the greatest country on earth, why should our prices of our drugs be higher than a third world country? You can go to Canada, you've heard it, you can get prescription drugs, you get them much cheaper, much cheaper, much cheaper. But what's driving healthcare was not designed to be an economic engine to be on the backs of people. But that's what it's turned out to be. It's all about what? The bottom line. It's not about your healthcare. Money, money, money. It's not, and I don't care if you're rich, poor, black, green, white, or blue. They treat, it's greed. It's corporate greed. Corporate greed, corporate greed. That's true. That's the case, and I commend President Biden for staying on. It took a long time, but he stayed on it. But we have to be more vigilant, and we have to understand that we are fighting big, big, big business. How they say, the rich and the super rich. There's 8 or 9 families that are rich, the Krafts, the Gettys, the Rockefellers. You know how that goes. And then you got Kraft, you got Coca-Cola. You just got a few companies.
You got Musk.
These are really monopolies. You know, there's an antitrust law in this country. You're not supposed to have monopolies. That's what I read about the Constitution. But excellent point. That's our job. It's tough. It's hard because they throw lawyers at you. They throw lobbyists at you, and it's hard. But it's the right thing to do, and we're gonna stay on that because it's true. Because you have to decide, I don't care what your income level, at some point in time, you got to, do I have to put my prescription drugs? Do I want to go out to have a dinner? Do I want to give my grandkids a few extra bucks?
Do you want to eat?
Or do I have to pay for this? That's what it's coming down to. And that, in the strongest country in the world, that should not be taking place. Yeah. We can do a lot more of sharing some of the wealth, as my grandmother, let's share some of the wealth. So I don't want to go off on a tangent. That always, it gets my emotion going. Yeah. Because I've seen people go to the doctor and say, hey, represent the hell with them. Yeah. The hell with them. You know, I'm going to spend that and that. And the doctor say, I need this. Yeah. Insurance comes and says, oh, they didn't approve that. Yeah. You can't have that. You got to go what?
Got to go through all this
appeal process. Good luck at getting in touch with them when you call them.
Yeah.
Good luck.
The other piece that you mentioned too about the one-on-one, there aren't enough doctors. Right. There aren't enough nurses. My 17-year-old kid, my 17-year-old right now, where she wants to be a nurse. Isn't it beautiful when you hear my little girl's name? His name is Luna, and Luna wants to be a nurse, and we're starting to look at schools. But when I go to these schools, you'd be blown away because they're only taking a certain amount of kids. They're not growing the programs. You know why? Because nurses aren't the money makers within the universities, right? And if you look at the medical schools are they're not taking in nurse practitioners, you know. And the biggest areas of growth, while it should be primary care, while it should be gerontology, while it should be obstetrics, guess what it is? It's it's surprising. It's the ophthalmologist, it's the dermatologist, it's everything on the it's everything on outside of the it's on the outside. Not exactly.
Since you're touching on education, I wanted to ask if there's been any significant increase in African American doctors or medical students.
No, it's actually
And if there
no.
was any increase, how has it affected?
No, no. These are things. These are things.
They say we did the medical program for black doctors. We tried to create our own.
They're trying to do the legislature here in Massachusetts is trying to do certain things. Loan forgiveness programs, all these, but it's never enough because there aren't enough people of color that are going into and being accepted into the nation's medical schools. And in terms of, and then when it comes to doctors that are coming from other countries, there is no reciprocation. I have a doctor the other day, a psychiatrist from Puerto Rico, graduated from the University of Puerto Rico. And he built a practice in Puerto Rico for 15 years. He had hundreds of people that he was taking care of. But his family moved here to Boston, and he went through 3 years of going through process to try and get reciprocated for his education and his practice from Puerto Rico here. And he still can't, and he's still frustrated at the process because there's still certain things that he's battling relative to that. And Puerto Rico is a part of the United States. And then there's and then at the same time, the healthcare system itself as well. They're going to other countries to look for people, but they're going to particular places, the Nordic countries and the Philippines and other places. But the process to get to that is really difficult, and you're subject to the immigration laws and H-1B visas, which are gold for the healthcare system and the education sector, because the education sector is doing it as well. So the struggle to have the universities in the country be able to react and to be able to grow, it's a big challenge.
Always good to you, Dan.
Yeah.
And the number one country that trains black and brown doctors is Cuba. Am I making this up?
Yeah.
See, I have an amen over here.
Yeah.
Yeah, Cuba is where most of your black and brown doctors come out. I mean, long before Castro, they go to Cuba, they go to the medical thing, they come out and they're licensed and they come back to the U.S. Yes, ma'am.
I'm a doctor, but I'm not going to ask you any medical questions.
Oh, good.
I want to know one thing from you. Do you gentlemen know what the reason for the Jewish Holocaust was?
Hatred.
Do you?
Hatred.
I'll tell you what it
What
was.
was it?
Greed.
Yeah. Oh.
Greed. When you kill people, you can take their possessions. And that's exactly what happened. When my mother and I survived from the whole family and the whole area, and I came back to my little town, the children that I used to play with were running inside when they saw me. And one day I asked my mother, I said, why are they running inside? They used to play with me before the war. She said, they're wearing your dresses.
Oh my God!
That is what it was. When you kill people, you can take their possessions.
Oh my God! Where were you? Where were you born?
Beg your pardon?
Where were you born?
Lithuania.
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 Thank you for that.
Oh my God!
Now learn from it.
Yeah, absolutely. Thank God thank God you're with us to share that. Thank you.
Beg your pardon?
Thank you. I said thank God that you're with us to share that, because there's only a few of you left.
Well, I thought I owed you that you should know it.
Yeah, thank
Because
you.
I know that you don't know.
What a show!
Didn't know that.
No, we don't.
Now you know.
No, we don't. Yes, ma'am.
Well, I have a question about the drug companies. Seems that I've heard, and I don't have it straight in my mind, that drug companies have colluded to be a monopoly, and on certain drugs that where the diseases are common, like diabetes, for example, and insulin. You know, President Biden has been trying to prevent them from raising the price for insulin because, but that's not the only one. For common diseases, the drug companies have the most powerful lobbies and lobbyists, and I think I heard that when they can't, I don't understand the laws about this, maybe you know more, when a company wants to compete with them and say, get another drug, another type of insulin, slightly different or whatever, generic, yeah. The drug companies have gotten laws passed that has to be somehow they have to keep their monopoly.
But if I'm another drug company coming, they make you do the trials.
Yes.
All the trials have to be done. You got to vet the drug. And that could take forever, basically. You have a very good point. Very good point.
I mean,
Let's not forget the Sackler family.
hey, Harvard still has their name on the museum. You know, they're in the endowment. It's real. It's real. But we're chipping away at it. We're chipping away at it from where we were, you know, when I started in government, when I started working as a state legislator, 20 years ago, to now, I feel a difference. But you got to stick to it, though. That's the only thing. It took us, Remember, Massachusetts was a unique spot because Massachusetts did do healthcare reform back in the early '80s under Mike Dukakis. He passed a law. Actually, for those of you that were here at that time, you probably voted for it, where they sought to insure the entire population. But the difference was under him, he did not have a shared responsibility commitment by everybody. And so in the next budget cycle after he passed it, the dollars weren't there to live up to that commitment. So then Massachusetts, so he raised taxes. Remember the moniker, Taxachusetts? Yeah. He was raising taxes because there were holes, and at the same time he had to push back from this healthcare law that he did that was pretty monumental. But again, he wasn't able to live up to it. And then we didn't get back to it until 2005. But we got it done. But again, as we keep on saying, there's more to do. So thank you so much, and push your family members to help us out.
But before we make the presentation for you, I want two people to stand up and be recognized.
Recognized.
Okay, Sebla Alemu and Cynthia Lewis. All right. Did you want to say a few things too?
If you don't mind.
Come on. I was hoping that you would.
Really good to be here. My name is Sebla. I work as a researcher for the Committee on Racial Equity, Civil Rights, and Inclusion. This is my manager, mentor, and mother, Cynthia Lewis. I'm just here because as we were talking, I want to help you feel empowered and that you have a voice in supporting the cause towards health equity. So what we were talking about in terms of creating standards of measurement, standards of care for everyone, young and old, and black and brown and white, everybody, right? So I just want to tell you that your representative at the Massachusetts State House is Representative Kay Khan. Yeah. You know her? She's great. She's so sweet, very friendly, says hi to me, so I like her.
She's been my friend for 22 years. She's an incredible lady.
Oh,
She's a nurse.
Yes.
Yes, she
Yeah.
is.
She's a nurse.
So I want to encourage you all. I have some pieces of paper, maybe I'll leave it at the back so you can take home, so you can see what the bill we are talking about here, and call your representative, Khan, right, to tell her to support the bill because this is important.
Just if you could sign on, we'd appreciate it.
Yes, I don't think she's a sign-on yet.
It's probably she hasn't gone and asked yet. You know,
Yeah.
we're still, we just started this, we just got this bill filed, so it's a new thing, you know?
Right, and then your senator is also a woman, good, go figure, Newton, is Cynthia Crean.
Yep.
You might know Senator Crean. So give them a call, tell them you talked to the Chairman Williams and Mr. Sanchez, and you want to support this bill because you want to make equity a reality.
What's the
And
number?
the bill number is H1250. 1250 in the House, and in the Senate, it's $7.99. I'll leave the copies of the paper here. Thank you.
Actually, no, we'll pass them on.
All right, I hope there's enough for everyone. Thank you for having us.
Good evening, everyone. I'm Cynthia Lewis. I am the Committee Director for Racial Equity, Civil Rights, and Inclusion under Chair Williams. My phenomenal researcher. And as she said, I'm kind of a mentor and a mom. But I am who I am because of my mom and my dad and how I was raised in the community. Every time anyone spoke here, I'm like, oh my God, I love my elders. Because you are the history. You carry the stories. And my dad has diabetes, glaucoma, dementia, and all the others. And I am the primary caregiver. So yes, I understand how it is to have to fight for medicine that's going to keep my dad alive. And so, as Sebla was saying, and you know, your voice matters. You are seniors. You have run this race. You know how to play the game. A lot of young people don't realize that their voice does matter. And our job is to get out into the community and let them know your voice does matter. One voice changes the vote. Do you know what I mean? And so if you're able to reach out to your senators and your state representatives and say, you know what? House of Representatives is the people's house. And if you're not representing me, we got to talk. Because you're supposed to be advocating for me and my welfare. And so pretty much that's all that I wanted to say. Thank you for your time. We are working diligently, steadfastly. The unfortunate piece is, as you heard Mr. Sanchez say, it takes a long time. You start one thing, then you have the brick wall, but you have to just keep chugging along. Thank you.
I want to thank everybody, the chair, Mr. Sanchez, Sebla, and Cynthia. So glad to meet you. We had sent emails, but we hadn't had a chance to talk directly.
Our pleasure.
Thank you very much. And I must say that this event was sealed by a handshake. Here's what happened. Sebla invited me to a Black Excellence Day several weeks ago. At that event, I met the chair. And we took our photographs, as you now know. I'm the shorter guy in that oval setting, right? We shook hands and he agreed to come. But Sebla was the one who was the propellant. She set it up, and I want to thank you so much.
Thank you.
All right. And give Alicia Del Vento our best because of your collaboration. We were able to do this.
Thank you.
Okay. So
Very much.
tell her we appreciate
I
it.
appreciate it very much.
All right. Now, as everybody here knows, but you don't know, Jeff, come on over.
Oh, that's too nice.
Come on up.
Oh, that's beautiful. Oh, you have to do that.
Oh, yes, we do.
Yeah.
Okay.
Wow.
That's very generous. Oh, wow.
Wow. Kind of heavy too.
Everybody knows what they say because they've seen this before, all right?
Oh, wow.
We thank you for coming and contributing to the Black History lecture series here at Cabot Park Village. You outdid yourselves,
Thank you.
and we always like to invite people back again.
Yes.
So we want to hear the consensus.
You guys are too kind, you're too generous.
Thank you. I didn't expect this.
You read the
Wow, I'm gonna try and impress my kids now. What do you think? What do you
Yeah,
think, huh?
take a picture.
You think I'm gonna get my little girl
Can
impressed?
you get a picture
Huh?
of them?
Yeah.
We'll get you. Also with
You better hurry up, I'm on the highway.
Excuse me, Jeff, come on over. We're going to read. I've been asked to read it out aloud, so I'm going to double back. With our greatest appreciation, Cabot Park Village presents, with this one, Representative Bud Williams, with this memento for your contribution to our Black History Lecture Series May 25th, 2023.
Thank you.
Excuse the redundancy. With our greatest appreciation, Cabot Park Village presents Jeffrey Sanchez with this memento for your contribution to our Black History Lecture Series, May 25th, 2023. The gentleman thinks we have deep pockets and keep talking about how expensive they are. But we're going to be in debt for this, but
That's it.
it's worth it.
Thank you.
These are not cheap, totally.